Hello, everyone. Welcome back to our newly revised interview series. Before I had been interviewing members of our congregation, and now we are interviewing people in our Cincinnati community and in our larger Jewish community. And I'm really excited to be joined here today with Lisa Kruse, who is a communications specialist with the Council on Aging, which is a Hamilton County-based organization. Lisa will definitely tell you more about the organization and the services that they offer. But Lisa, thank you so much for being with us today.
Well, thank you so much for having me, Rabbi Shapira. I'm excited to tell you about COA today. And before I do, I want to tell you a little bit about myself. I have lived in Cincinnati since the early 80s. Via Louisville and Washington, D.C. and Pittsburgh. I graduated from Xavier University with a communications degree just a few years ago. My husband and I are enjoying being empty nesters. My daughter is in a PhD program in Illinois, and my son is a sophomore at the University of Cincinnati. I've been with the Council on Aging for about a year. And I recently witnessed my father's decline with vascular dementia. And I was, and still am, very much in the sandwich generation because I was parenting my children while taking care of my father. I wasn't his primary caretaker. My mother was always there and was always by his side, but it did take quite a toll on me. He died in January of this year. And my 94-year-old mother-in-law recently finished rehab after having her third heart attack a couple months ago. After her first heart attack, actually, her hospital discharge nurse suggested that she call Council on Aging. And she did. This was about maybe 10 years ago. And through our ESP program that I'll be talking about, she was able to have someone come and clean her house on a regular basis and also have a life alert button that she wore around her neck. So that was a very good thing to, make her life easier for her. So now let me share my screen. And we'll talk about Council on Aging. So in the next 20 minutes, we'll talk about the state of aging in our region, area agencies on aging, of which COA is one, our mission, long-term care, our programs and services, and I'll touch a bit about caregiving. I'll start off with a few statistics right now. This statistic at the bottom of the screen just blows me away that for the first time in US history, people aged 65 and over actually outnumber children under the age of 5. That is just phenomenal to me. Now let's take a closer look at our region. COA service area includes 5 counties: Butler, Claremont, Clinton, Hamilton, and Warren. We are the 7th most populous state with over 11 million people. We have the 6th largest older population in the nation. Nearly 1/4 of our population is 60 and above. And these maps show the percentage of residents who are age 60 and older in each county. And as you can see from the percentages in the span of just 20 years, from 2010 to 2030, there's a dramatic transformation. This age wave creates a lot of obstacles and challenges, but also we have tremendous opportunities. And that's what COA is all about. So if you know of anyone in another part of the state or the country who needs in-home care or just simply help understanding care options, you can start with the Area Agency on Aging in that area, also known as AAAs. COA is the AAA for Southwest Ohio. There are 12 in Ohio and more than 600 nationwide. If you need to find services in another part of the country, you can use the Elder Care Locator, and the website is on the screen at eldercare.acl.gov. AAAs give unbiased information and advice on services that might be available to meet your lifestyle needs and those of your loved ones. It includes coordinating in-home care, facing smooth transitions from one care setting to another, for example, a hospital to home in the community, providing health and wellness activities, education, and information and referral services. AAAs are part of the National Aging Services Network, which was created with the signing of the Older Americans Act in 1965. So as I mentioned, we are part of a national network created in '65, and it starts with the U.S. Administration on Community Living, then goes to the Regional Office on Community Living, to the State Unit on Aging, which is the Ohio Department of Aging, Area Agencies on Aging, COA, local service providers, such as senior centers, home care providers, meal providers, transportation services, and then the older adults themselves. So at COA, we strive to make the lives of older adults as full as they can be. We assist people to remain independent through a range of quality services, which I will talk a little bit about. We're not like other service providers, such as home care agencies, hospice, or hospitals. We contract out our services, which allows us to serve our clients as well as the taxpayer. We have been a AAA since 1974, serving older adults in our service area that I mentioned before: Butler, Claremont, Clinton, Hamilton, and Warren. We manage most of the government funding that is available for services to older adults in Southwest Ohio. County tax levies equate for about 40% of our funding. Medicaid programs provide another 30%. Additional state and federal funds, client contributions, donations, and other support provide the last revenue. So it's not easy all the time facing reality, but I do want to mention that 70% of us will need some type of long-term care during our lifetimes. 9 out of 10 of us would prefer to remain in our own homes as we age. I want to talk a little bit about what we do in the community. We are in the community every day in homes, hospitals, and nursing homes. We've provided support to more than 20,000 seniors and people with disabilities. We contract with hundreds of organizations to provide millions of hours of in-home care. We've responded to more than 50,000 requests for information, provide millions of meals to seniors through congregate and Meals on Wheels programs, provide thousands of transportation trips for medical and senior center activities. So during this pandemic, we are still doing everything we can to support older adults and their well-being. Just a little bit about what we've been doing. We have a comfort meal program in which we have provided more than 30,000 comfort meals. And what that is, when we know that when times are tough, food can become increasingly important. And during the pandemic, isolation is definitely a big issue for a lot of people, especially older adults. So we have delivered thousands of comfort meals from places such as La Rosa's, Taste of Belgium, Frisch's, and others. We are leaders of a local work group focused on limiting the spread of the virus. We've delivered household and personal care packages. We've distributed donated PPE to our providers who then can safely care for our seniors. We've delivered emergency food boxes to our home delivered meals clients, as well as about 500 or so that are people who are not clients. So a bit about long-term care. I mentioned it briefly earlier, but I will go into it a little bit more now. Contrary to popular belief, long-term care is not a one-way trip to the nursing home. In fact, long-term care is more likely to be delivered in a variety of settings, such as home, adult day centers, and assisted living facilities. Many people learn about long-term care the hard way, when they or a loved one need it and need it quickly. That's when they discover that long-term care can be expensive. Medicare doesn't always cover it. There are many complex issues such as finances, insurance, legal matters, and the options may be limited if you haven't planned ahead. So some things to look for. When we determine eligibility for one of our programs, one thing we explore is the determination if an individual needs help with activities of daily living, or ADLs, such as bathing, dressing, toileting, and you can see on this list, safely preparing meals, suffering from dementia or Alzheimer's, being a fall risk with a potential for an accident. Many of these things might be familiar to you. By no means am I an expert on Medicare, but I do know that Medicare does not pay for 24-hour-a-day care at home, meals delivered to your home, or custodial or personal care if this is the only care that you need. So what help is available? Well, it depends on where you live, plus your income, level of care, and your age. These are the primary criteria that we use to determine eligibility. So now I'd like to talk a little bit about the Elderly Services Program. We call it ESP. It's different than Medicaid programs because Medicaid programs can create an eligibility gap because so many people don't meet the income qualifications for Medicaid, yet they still can't afford to pay privately for care. So ESP covers seniors who are stuck in the middle. For those who don't qualify for Medicaid, we help fill the coverage gap. Income is not considered for program eligibility, but it might be reviewed and there may be a client copay. But people should not exclude themselves because they think they have too much money to qualify. So what kind of services are available through ESP? Well, again, it's activities of daily living that we look for that people may need help with. And eligibility for each service is determined by an ESP care manager. It's also important to understand that our programs and services supplement whatever care is already in place through family, friends, neighbors, that can be provided by another caregiver. Our goal is to provide the right amount of services at the right time. Some people need 1 or 2 services for a few hours each week. Others require more care. Our programs are flexible and they change to meet the needs of the older adult. So eligibility for ESP. The older adult must be 60 or above. again, need help with certain activities of daily living. It supplements the care that already may be in place. But I do want to stress that you don't need to worry about all of the eligibility requirements for our programs. All you have to do is call us and we'll do the rest. We'll determine eligibility and give you information and resources. So all you have to do is tell us your situation. I do want to briefly mention that we have a program called Fast Track Home via ESP that helps make the transition smooth between a hospital stay and returning home. Many times people who are in the hospital are able to return home simply because Fast Track Home is able to provide the resources and services that ESP provides. Otherwise, people may need to be discharged to a nursing home. So Fast Track Home does a real great job in keeping people out of the nursing homes. Another program we offer is called Passport. It's similar to ESP, and it includes people who qualify for Medicaid. It's Ohio's in-home alternative to nursing care, and without it, many disabled or low-income older adults would be forced prematurely into nursing homes. These programs require meeting qualifications for Medicaid. You can see the income qualifications at the bottom of the screen. We do have these 3 programs: Passport, Assisted Living Waiver, and MyCare Ohio. Whether or not you are part of a COA program, we connect you to other programs and services that are available to seniors in our service area, such as home delivered meals, legal assistance. We work closely with Pro Seniors, and I want you to know that legal assistance is free for Ohioans age 60 and above. We offer healthy living workshops that we're actually offering now throughout the city. And we offer our caregiver support program, which I'll touch on actually right now. So you may be listening today while you're caring for an older adult in your life. Caregivers assist with everyday living. They advocate for their older loved ones while they manage their care. Many caregivers do not identify themselves as being a caregiver. They're simply doing what needs to be done as a family member or a spouse or a child or a friend. We have our caregiver support program that provides one-on-one support to reduce the stress that can sometimes come with caregiving, increase a caregiver's confidence, improve the quality of care, and help bring a sense of balance to the life of the caregiver. We have a dedicated caregiver support nurse. Her name is Anna. She's in the middle of this photo. Our caregiver program is completely free. I do want to mention there's no age requirement for family caregivers who provide care for individuals with Alzheimer's or related disorders with brain dysfunction. We have a specific section on our website that deals with caregiving. And that brings me to how to reach us. We have by phone or online. Our website is help4seniors.org. And again, if you don't know what to do, simply call us and explain the situation. We will take it from there and ask a few questions to determine eligibility and make sure that you are in the right program for you. Our call center is open 8 to 5 each weekday. Our Tri-County office building is open 8 to 4:30 during the week. And after hours, you can obviously use the contact form that's on our website, or you can leave a message, knowing that a referral may be made on someone else's behalf. And that is what I have for you today. Thank you very much for listening.
Lisa, thank you so much for the just amazing presentation. It's not only was it really clear and easy to follow, but I think a lot of our congregants and a lot of people in Cincinnati in general don't quite know the breadth of the services that COA provides.
Sure.
So thank you for bringing that all to us. I do have a question, and that is, how can we, as both a religious community and a nonprofit organization as well, how can we help you guys?
Well, we are right now utilizing volunteers to create commodity boxes, thousands and thousands of them, to send out to the community. What I would recommend is that you call our call center, or anyone who's interested in volunteering would call our call center and again, explain the situation. And, there are lots of people that need a lot of assistance, especially during the pandemic. And we would be happy to work with anyone you have.
Wonderful. So if anyone is interested in doing some volunteer work for the Council on Aging, give them a call, and we can, all take a part in helping, helping our elderly population, which really is a core Jewish value, is helping those who are the most vulnerable in our community.
Sure.
I think it's beautiful that our taxes go for that. It's good to know where our taxes are going, and it's good to know that our taxes are going to somewhere, to something that is so beneficial to the community. And it's also good to actually go out there and do something. So I encourage anyone who's watching this to make that call, see how you can volunteer your either your time, or if going out there is not comfortable for you because of the pandemic. There's donation opportunities, which I'm sure are on the website.
Absolutely, they are on the website. And I'm glad you mentioned that, because I do want to mention that our Comfort Meal program, we are in the process of making sure that the Comfort Meal program continues after the CARES Act funding that we have received is no longer available. So a campaign for that is in the works, and donations are greatly accepted, as in any form.
Yes, so to make sure that the most vulnerable in our community have food to eat. Yes. Yeah. Well, thank you again for this amazing presentation and for giving us a way to act and to live out what it means to be a successful Jewish adult, which is to, take care of our society and everyone in the society.
Well, thank you very much for having me today. I'm really glad I got to share the information with you, and I hope that it was beneficial.